Aloha, everyone, and thank you for joining today's webinar, How to Talk to Parents About COVID-19 Information and Vaccinations. My name is Michelle Tagorda Kama, and I am the project manager for the Vaccination Outreach for Hawaii Students project. Before we get started, there are some Zoom housekeeping that we'd like to go over with all of you. For all questions, please utilize the chat box or question and answer box located at the bottom of your Zoom screen. No continuing education credits will be provided during this webinar, and all webinars will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, I would like to introduce you to our presenter for today. Dr. Rupali Limaye is the Deputy Director of the International Vaccine Access Center at Johns Hopkins Bloomberg School of Public Health. Dr. Limaye studies how health information can best be communicated to individuals in different contexts and through different channels. Widely seen as an expert in vaccine decision-making, she started her career working in advertising and is a health communication scholar. She received her PhD from the Johns Hopkins Bloomberg School of Medicine, her MPH in Global Health, and MA in Foreign Policy from the George Washington University, and her BA in Political Science and BS in Journalism from the University of Kansas. Please join me in welcoming Dr. Limaye.
Thank you so much, Michelle, and it's great to be here. Let me just share my screen here and make sure everyone can hopefully see this okay. So as Michelle mentioned, my name is Rupali Limaye. I serve as a faculty member in the departments of International Health, Epidemiology, and Health Behavior and Society at the Johns Hopkins Bloomberg School of Public Health, and it's really nice to be here. Today I'm going to focus on how do we focus on COVID-19 vaccine confidence? What are some of the ways in which we can improve our communication so that we can reduce vaccine hesitancy and get more individuals to accept the vaccine? So I want to start with just a little bit of where we are in the United States and what's been happening specifically related to COVID. So as of this month, about 66%, so 65.8% of the eligible population over the age of 18 is fully vaccinated. So that means that we still have another 35% of the eligible population over the age of 18 that has not yet gotten vaccinated. 57% of the eligible population in terms of ages 12 to 17 are fully vaccinated. And when we think of those that are in the 5 to 11-year-old category, only 27% of that eligible population has been vaccinated. I think many of you are probably familiar, but there are ongoing trials related to the vaccine for children aged 6 months to 4 years, with recently Moderna just requesting an emergency use authorization for their product that is targeted towards this age group. So with regards to what we are currently seeing with cases, you can see here, this is going back to March of 2021. And you can see there was a bit of a surge that we saw, particularly in the late fall months and in the early winter months, but we're starting to see cases fall. However, the one thing that I would note is while we are starting to see cases fall, we are starting to see increases in wastewater surveillance, which is one way we can track and try to estimate prevalence and incidence of cases with regards to COVID. As many of you probably know, BA.2 is now the dominant variant here in the United States. That just happened, I think, last week. And so we're going to continue to monitor this closely moving forward to see how cases change over time. So the question is, what is really driving people? I mentioned earlier that 35% of the population over the age of 18 is not fully vaccinated. What is driving their hesitancy, and what are some of the reasons why people do not want to get the COVID-19 vaccine? So I want to start with a little bit of history to provide a little bit of context. So before COVID-19, there was a number of reasons why people did not want to get a vaccine. And primarily the reasons and individuals that did not want to get a vaccine were parents. So parents had concerns related specifically to childhood vaccines. These concerns were usually one of four. One, the parents would say that there are specific vaccine ingredients that they were concerned about. So for example, parents would say, I know there's formaldehyde in a vaccine and that worries me. Second, the vaccine schedule. Parents were concerned about the number of vaccines and the number of doses their children were getting between the ages of 0 to 24 months. The third issue was really related to misperception that there was a link between vaccines and severe adverse events. While there was a study that was retracted and soundly refuted that came out in the late 1980s that said that there was a link between vaccines and autism, this was soundly refuted, the paper was retracted, but we still continue to hear this concern from parents. Finally, parents really had low levels of risk perception. They did not think that the vaccines that were recommended for their children were needed because they did not feel their children were susceptible to the vaccine preventable disease, or they did not think that the disease was severe enough to warrant an action, i.e. getting a vaccination for their child. So these have changed since COVID has started. So those were pre-COVID. Since COVID, we've seen some other drivers being added to this combination. So for example, we know individuals really feel distrustful towards the vaccine process. There's a lack of confidence related to the vaccine process. There's also quite a bit of misinformation and disinformation. And there's also been quite a bit of polarization. So the image I have here is essentially the way we think about vaccine behaviors. So they're not a yes, no. People don't say yes to a vaccine or no to a vaccine. Most people will say that they are comfortable perhaps with some vaccines and not others. Some people are comfortable with vaccines, but might have some concerns about that vaccine. And then we do have individuals that are fundamentally and philosophically opposed to all vaccines. So if we think of each of these drivers that we've seen during COVID, so distrust and lack of confidence. Let me give you a little bit of information related to this. So over the past 24 months, I've been holding Q&As with African Methodist Episcopalian Zion congregations, and I've met with more than 50 congregations in a number of states. Essentially, these individuals are usually a little bit older. They're typically over the age of 40. And the key concerns that I've had after speaking to more than 2,000 individuals within these meetings is that there's a lot of distrust towards the vaccine development process. This includes the timing. This includes how participants were recruited. In addition, there's also distrust with regards to the healthcare system. This is not only due to the fact that there has been historical trauma related to medical experimentation, but this is also because individuals are facing racism as well as discrimination. Particularly, this is among people of color. In addition, individuals have indicated that they have a lack of confidence and will ask questions like, is the vaccine safe for Black people? And there's a lack of confidence related to if the vaccine is safe and effective if you have a comorbidity, i.e. people will say, I have emphysema, I have COPD. How can you tell me that the vaccine is safe with these other medical issues that I may have? Continuing into this distrust and lack of confidence, I've also been holding Q&As with nonprofits that serve incarcerated populations. And over the last 12 months, I've met with about 100 different individuals that are incarcerated. These are primarily Hispanic and African Americans, and they're generally a bit younger in age. The concerns that have come out of this group are very similar to the group with regards to the church congregations that I've been speaking with. So there's distrust of the vaccine development process, again, the timing and recruitment. There's also distrust of the healthcare system, again, due to a history of trauma and current racism and discrimination. But there's also concerns related to the efficacy as to whether or not the vaccine actually works. A second key issue after thinking about confidence and distrust is misinformation and disinformation. So there's a distinct difference here. So when people spread misinformation, they really believe what they are sharing. Disinformation, on the other hand, is really crafted and it's disseminated with the intent to mislead other people. So an example I can give you is that if a political leader claims that COVID-19 is no worse than the flu, despite knowing that that's not true, that is disinformation. But then if someone hears it or sees it on social media and then shares it, that's misinformation. So we've really struggled during this pandemic with misinformation and myths. And what you're seeing here was essentially a survey that was done by the Kaiser Family Foundation. And essentially the chart is showing you the percentage in each vaccine intention group who said they've heard at least one myth and whether or not they believe it's true, or they're not sure if it's true. So essentially you can see that, for example, Republicans are much more likely to have heard a myth and believe and really be unsure if it's true or not. And as well, with regards to ages, we know that younger populations have heard myths and might be more likely to believe it's either true or not sure if it's true. So this is a key challenge with regards to communication, and how do we make sure that we mitigate myths and misperceptions? So what we're currently in is what I call an infodemic, and it's essentially a pandemic of an overload of information that people have really been trying to process and understand. So while there have been a lot of public health measures and recommendations, that has been accompanied by lots and lots of information that has really been fueled on social media and lots of other different platforms. And so it's really hard for people to understand what is true, what is not true, how to sort through all this information, and who to trust. The other piece that we've seen that has really complicated matters is this idea of a polarization of attitudes. And so what you're seeing here, this was an older study, but it really illustrates the point, is that it's really a snapshot of links on a certain day with regards to Facebook vaccine clusters. So what you're seeing here is that the blue dots essentially represent pro-vaccination attitudes, the red dots represent anti-vaccination attitudes, and the green dots are undecided. The reason this is so striking is that you can see that there's a lot of space between the blue and the red dots. There's not a lot of mixing. This indicates that people have something called echo chambers, where they essentially speak with networks that have similar attitudes than themselves. So the problem with this is that this does not allow innovation to flourish. You don't hear different views. And so when you're looking for information, you're essentially hearing confirming information of what you already believe or what you already think. The other key piece related to this polarization and fake information is that we know that certain populations are also more susceptible to information that is not evidence-based or fake news, for example. So this is showing you essentially about 15,000 different individuals that are on Twitter, and the size of each dot represents the number of accounts that share misinformation. And you can see here essentially that if you tend to be a little bit more on the conservative side, you're more likely to share misinformation. So we do know that there is a susceptibility that we also need to think about to misinformation. So now that we've talked about not only the drivers before COVID, but the drivers of vaccine hesitancy related specifically to COVID, what are some approaches that we can use? What are some things that we have tried to reduce hesitancy and to get people to feel more comfortable about taking the vaccine? So the first that we've really seen is that if you are a trusted individual, if you are a faith-based leader, for example, you're a community leader, you're a school leader, giving something called a strong and personalized recommendation is really, really important. So communicating related to the importance of why they should get the vaccine, encouraging them to get the vaccine that day, and being consistent when you're speaking with someone that you are promoting the vaccine is really, really important. This last bullet is with regards to if this is happening in a provider context, speaking to a client. And so if a healthcare provider is talking to someone, and this can actually be for anyone, it doesn't have to be the healthcare provider, but to talk about your own experience. How did you decide to get the vaccine? Did you have concerns? How did you allay those concerns for yourself, and so forth? Another key strategy that has been used is something called presumptive communication. And it's essentially when you're having a conversation with someone, really assuming that the default is that people are getting the vaccine, that it's the norm. So for example, one way that you could say this is you could say something like, hey, I know that 80% of second grade parents, for example, have gotten their child the vaccine. When are you going to get your child the vaccine? So not only do you highlight the norm of what people are doing, but you also assume that the person is going to get a vaccine. Another communication technique that we can use is something called motivational interviewing. And so this is generally for people that might have sort of more severe or significant concerns, I would say, about vaccination. And so it essentially employs a number of tools: active listening, reflections, meaning when someone says something, you reflect back to them what you're hearing, asking someone an open-ended question, things like, well, why do you have concerns? Why do you feel that way? Asking permission to provide additional information. So when someone might present you with misinformation, you would say something like, can I share with you what I've learned from my pediatrician or someone else I trust? And also acknowledging that autonomy as a means to strengthen the perception that we're working together. Again, this is within the context and has been studied primarily within the context of a clinician and patient, but this can happen in any relationship. So saying that having this conversation and really empathizing with a person and saying that we're really working together towards a shared goal really helps with regards to building trust. Another key communication technique that can be applied is something called tailoring. So what this does is that you essentially listen to someone's concern, and then what you do is you respond to that specific concern. So you tailor information to that specific concern. So if someone comes to you and says, you know, I'm really worried, I know that there's formaldehyde in a vaccine and I'm really worried about formaldehyde, you could respond by saying something like, I understand it's hard to understand what is true and what is not true, but perhaps did you know that there's more formaldehyde in a pear? So again, tailoring your response, being empathetic in that response, but explaining and trying to illustrate in a way that the individual that you're speaking to would understand. I am going to stop here for a minute because I would like to show you all, we have done a number of videos that have really focused on illustrating these communication techniques. And so I just want to show you a couple of these videos so you all can just get a sense of what I am talking about. So let me see if I can get this to work. Okay.
What is misinformation? Some of the information in this social media feed is true, but some of it isn't. How can we tell what's true from what's false? Social media allows false information about COVID-19 and vaccines to spread quickly from person to person, just like a virus. Hence the term going viral. Once you learn to spot false information, you can help stop the spread. There are a few different flavors of false information you might see online. Misinformation. This is when people share information that's actually false or misleading, but they don't realize they're sharing information that isn't true. This is like when your auntie or grandpa shares helpful articles on social media that are actually false. Disinformation. This is when people intentionally create false information and spread it to cause harm or to make money. This is like when someone makes up false news stories with phony images to drive traffic to their website so that they can sell ads or cause confusion. Both misinformation and disinformation are spread online by relying on a few tricks. Knowing these three strategies will help you spot false information and stop the spread. Emotion. Highly emotional stories spread more quickly on social media. Ask yourself if a post or story uses emotion words to generate fear, anger, outrage, or other emotions. Fake experts. Another strategy to trick us into spreading false information is presenting an unqualified person or organization as an expert. For example, someone may have a PhD or expertise in one field, like engineering or computer science, but that doesn't mean that they are a COVID-19 expert. Take a close look at whether an expert actually has training and credibility in the area they are talking about. Conspiracy theories. People can become more vulnerable to believing conspiracies during times of uncertainty. Conspiracy theories can be defined as believing that unexplained events are being carried out by a secret group or organization. Here are 4 steps to take to combat misinformation when you see it. Step 1, state the true fact. The vaccine was rushed, so it's not safe. Fact, the technology used to make COVID-19 vaccines is not new at all. It's been in development for decades. Step 2, warn about the misinformation myth. It's a common myth that the vaccine was rushed. Step 3, explain how this myth is misleading people. The myth in this post is really misleading. It's because the technology used for these vaccines was actually very well researched over many years that they were able to produce vaccines in record time. Step 4, repeat the facts. The fact is that these vaccines are the result of many years of research and testing. Over 70,000 Americans were involved in the COVID-19 vaccine clinical trials in 2020. These trials showed that COVID-19 vaccines are very good at helping people stay safe and healthy. You can make a difference. Research has shown that debunking and correcting can help reduce the impact of misinformation.
So hopefully everyone could see that okay. I want to show one more because I think we have enough time where I can show you one more that we've done. We've done actually a couple of different videos that I think have really helped individuals kind of go through and think about how they could also communicate and what are some talking points I would say that individuals can use. So let me try and do full screen.
Why should you vaccinate your 5 to 11?
Start it over. Okay.
Why should you vaccinate your 5 to 11-year-old? 1. We do not know the effects long COVID may have on a child's development. 2. Children can get very sick and die from COVID. 3. Vaccinated kids who are exposed to COVID won't have to do a traditional quarantine. This means less time out of school. 4. Getting kids vaccinated helps protect everyone, such as their grandparents and teachers. 4 reasons why you should vaccinate your 5 to 11-year-old. We do not know the effects long COVID may have on a child's development. Children can get very sick and die from COVID. Vaccinated kids who are exposed to COVID won't have to do a traditional quarantine. Getting kids vaccinated helps protect everyone. To find a vaccine near you, go to www.vaccines.gov.
Let me just show one more. And fun fact for that last one that you just heard, that's actually my husband narrating because I forced him to help with this video.
It can be difficult to have conversations with people when you may not see eye to eye with them. We will go over 3 communication techniques to help navigate these challenging conversations. Presumptive communication is a technique where you structure your conversation in a way that presumes the behavior is the norm. Skylar, my 7-year-old, has an appointment at the pharmacy next week. When is Ellis's appointment? And did you know that 80% of parents in our neighborhood are planning to get their 2nd graders vaccinated?
Oh, wow. I didn't know that so many 2nd grade parents were planning on getting their children vaccinated.
Motivational interviewing is a technique where you structure your conversation in a way that guides someone to strengthen their motivation for change. I recently took my 10-year-old Alex to get the COVID-19 vaccine. Jaden is 10, right? When are you planning on getting Jaden vaccinated?
I need to learn more about the vaccine trial process.
I'm glad you're taking the time to learn about the vaccines.
I'm just not convinced that there's enough information. I'm gonna wait and see.
I understand that you want to make the best choice for your family. I'm glad we were able to discuss your concerns about the vaccine. It can be hard to know what's right and wrong, as there's so much information out there. Our pediatrician shared some information with me. Can I share it with you?
Sure, that would be great. Thanks.
Tailoring is a technique where you structure your conversation in a way to ensure that you are responding to specific needs and that the information you provide is salient. I'm so relieved that Skylar, my 7-year-old, can get vaccinated.
I just don't know about getting the vaccine for my 6-year-old Kai.
What are you worried about?
I'm worried about some of the ingredients in the vaccine.
Every ingredient in the vaccine has been rigorously tested for safety and efficacy.
Oh, I didn't know that.
With these 3 techniques, you can have helpful conversations with people in your community.
All right, let me stop sharing this part and go back to the PowerPoint. But if you are interested, we have a number of different videos that we have pulled together and that are available. Particularly, we have a YouTube channel. And so if you are interested, I can put the link in the chat as well. So besides those different techniques, there's one other thing that you may have heard in the misinformation video, and it's something called prebunking and inoculation. And so in the same way that we use a vaccine to get your body ready to be ready to fight if the real virus is exposed and comes into contact with your body, we do a very similar type of approach to try to get people ready for counter arguments. And so you can preemptively expose people to weakened examples of common techniques that people use to spread misinformation that helps them generate and think about how they would react if they heard some kind of misinformation using the same technique again. And so this has been tested in a number of different settings. And so it's just another way to really get, especially young people, they've used this a lot to help them figure out and kind of wade through and identify when they're looking at misinformation particularly. Another key communication technique that can be used is something called the availability heuristic. And what that does is that helps us think about a shortcut in the ways in which we think about specific events. So an example I can give you is it's really easy for us to remember, for example, when there was a plane crash, it's hard to recall something related to a safe flight, right? You don't think about that as much. And so this can really lead to fear of flying. So it's really important to think about how people are estimating probability based on the instance of how that event can happen. So for example, if there's a statistic that is something like your chance of having a severe adverse event because of the vaccine is 1 in 1 million, another way you could say that is you could say, you're more likely to get struck by lightning than have a severe adverse event. Because again, that's a way for you to think about it. It's a heuristic. It allows your brain to have a quick shortcut to help you make sense of what someone is trying to say with regards to risk. The other thing is that it's really important to not correct misperceptions. And this is really challenging. I think sometimes we might hear things like people come to me and they say, Rupali, I know that there is a microchip in the vaccine. The response might be, no, there's not. But instead, the better response would be to kind of take your time, empathize with the concern and say, I'm sorry that there's so much misinformation. And I understand that there's so much misinformation out there that you might have a concern, but let me tell you a little bit about the vaccine development process. And so you're still trying to give them the correct information, but you're not rejecting what they're saying, because this really leads to trust. And again, this is really done through an empathetic and compassionate type of approach. And I think that is actually the end of the slides I have. I didn't want to have too many slides because I wanted to make sure that there was really time for discussion and for questions. I will put in the chat, if you are interested, we developed a course that is free. It's on Coursera, and it's essentially for anyone. It's not for healthcare providers. It's for anyone that is trying to really navigate having conversations with people that might be challenging for people that they don't see eye to eye with. It's free. It has a lot of videos. There's a number of videos. A lot of my students narrated a lot of these videos, and we've had more than 10,000 individuals already take this course. And so I will drop it in the chat as well in case that you are interested or you would just like to learn more. So thank you so much for allowing me to talk a little bit about our work.
Yes, thank you so much, Dr. Limaye. I know many of us on the webinar today really appreciate all of the expertise and knowledge you've shared and all the strategies to help us in our work with our different communities. As a reminder to folks joining us, again, feel free to add your questions either into the chat or our Q&A box within the Zoom webinar window, and we'll be able to have a discussion with the remainder of our time here today. So we do have a few questions to get us started, Dr. Limaye. So my first question for you here is, are there ideal times or maybe even an ideal environment to hold conversations with parents around the topic of vaccinations? For example, maybe is it in their home or in the classroom setting or school setting? Your thoughts on that?
Yeah, no, it's a really good question. And I put in the chat the link to the course that I was referring to. And, you know, the reason that we actually developed this course was kind of out of my own sort of personal story. So I'm a mother, I have 2 children under the age of 12. And so there has been a lot of questions from, you know, different friends and different children that my children go to school with from their parents that have essentially been asking me, like, what do we need to do? And so one thing that I've really noticed is parents really are looking for other parents that they trust to give them information about what to do. We've been living in an uncertain time for a long time because of COVID. And I tend to have a lot of these conversations at the bus stop because it's sort of where you are, you're with other parents, you're kind of relaxed, right? And we just inevitably, the conversation has been turning to COVID just because of where we are. And so sometimes I will get a lot of questions there. I mean, another thing that you can think about as a teacher, you know, we during the summer, and of course for you all being in Hawaii, who have much better weather than we do, in the summer I used to take my kids to the pool quite a bit. And so parents that I knew would come up to me and would say, hey, do you mind talking to my friend? She has a question about the vaccine, or she has a question about what to do for my 5-year-old or my 12-year-old. And so that was just another way to kind of have that conversation. So it was in a relaxed setting, I would say. And it usually starts with just a question that someone may have, and it sort of is more of a casual, I think, kind of conversation. But I know that many parents are looking to teachers to kind of provide information and have these conversations. And so again, I would just start the conversation as well as you can in a bit of a casual manner, where it's not during kind of a rushed time that the parent is stressed, or drop off, for example, might be stressful for them.
Great. No, I think that is definitely helpful in thinking about when would be the right time to have that conversation, and also sharing our own experiences. I know that was one of the strategies you had shared in terms of, you know, being able to build that empathy when having these types of conversations with each other. Awesome. So I guess another question kind of related to that in terms of conversations to have, is there specific language that you would recommend using when asking a parent or working with parents if their child is vaccinated?
Yeah, I mean, I think one thing that you can say is I would always sort of talk about it as the normative behavior, right? So, you know, saying something like almost along the lines of, hey, you know, did you know that 80% or whatever, 70% of parents have vaccinated their child? What are you thinking, right? Again, open-ended questions would be key here. No judgment would be key here. And also trying to, I think, highlight the social norm that most people are vaccinating, most people will vaccinate their children. And I think really highlighting that is a nice way to kind of open the conversation. I think it's important to not use any kind of stigmatizing language, even if you're very pro-vaccine and want children in your community to be vaccinated. I think it's really important to come at this again with empathy as much as possible, and understanding that everyone has different reasons why they might have concerns.
Wonderful, thank you. I think that's definitely a good reminder for us, and that compassion to still have for one another, even in these times. And I know part of what you had shared was, you know, some of these topics can be polarizing. And so remembering still that the humanity behind what we're trying to achieve through getting more vaccinations. Awesome. Another question had come through. I see a lot of parents are getting vaccinated, but aren't getting their children vaccinated. Why do you think that might be?
You know, and we've seen that here also. I live in an area where we have really high vaccination rates. And so it's really interesting to talk to parents and to see how their own behavior is translating or is not translating to their child's behavior. Part of it has to do with the fact that I think that when the vaccine was first recommended, when the EUA came out for the Pfizer 5 to 11-year-old product came out, I think that there had only been, that vaccine had been along for a much shorter process, I would say, than the adult vaccines. And so I think parents were kind of like, I don't know. So that was one reason. I think the second reason is that the messaging has always been, is that COVID-19 is mild in children, right? That has been what we have heard. That has been what has been promoted. We know with the new variants that that might not be the case. We've had, I think, more than 1,000 children die of COVID now. To me, every single one of those deaths is preventable. We shouldn't have any children dying from COVID. And so I think it's been just the way that the messaging has gone throughout the pandemic that parents still have in their brains, like, well, I heard that it was mild, so I'm not sure why I need to get it for my child. And so that's a reason. I think the third reason is also that there is also, I think, a bit of this hesitation of, well, does that mean my child will have to get a booster the way that adults are recommended? When will this ever end, right? So I think there's a little bit of that fatigue as well, that parents are kind of tired of dealing with changing recommendations. And one thing I should say is that from a public health perspective, the reason recommendations change typically is because new data come in. And so the recommendations reflect that. And so from our perspective, we see that very much as progress and the way that science works. The general public kind of sees that as, you all don't know what you're doing. You keep changing, telling us what to do. You first told us we needed to wear a mask. Then you said we didn't. Now we're back to, you don't need to wear a mask. So I think there's also a bit of that. They're not sure who to trust. And it's kind of exhausting for them also to sort through, as I mentioned, all of this information on social media, because it's just overwhelming. It's just so much, and it's hard to sort out what is true and what's not true.
I know in your talk, I really appreciated how you mentioned kind of the historical events that might have led to that mistrust. And so being able to recognize that and also lean on the folks that could help us in those messaging, especially as news and information continues to change. So a lot of work on the public health side and being able to work on that communication. So I guess related to the next question, how can you find a common ground with someone who has different beliefs around COVID-19 and vaccinations?
It's a really good question. And I will say that there is a lot, you will always have common ground in something, whether or not that's might not be related to COVID. It might be related to that you both are really supporting and want the best educational attainment for their child, right? That you have common ground. And so I think there are ways to build that trust and empathy, that you're here to essentially try to help support them make the best decisions for their child. At the end of the day, what we really want parents to do is to make evidence-based decisions. I, as someone that has studied vaccine science for a while and understands and studies infectious disease, I of course want people to get vaccinated. But in the end of all of this, I want people to make an informed choice. So if they look at evidence-based information and they still say no, I can respect that decision. But there is a way for us to be, I think, have common ground with that really being, I care about your family, I care about you. And so I'm here trying to just give you information, again, that's evidence-based, and understanding that, you know what, sometimes you might not see eye to eye related to COVID, and that's okay, but we just need to be respectful.
That respectfulness for one another is definitely something we have to continue to remember and continue to practice. But I like that in the sense of, like, there is always going to be that common ground, or trying to find that common ground when working and speaking and having conversations with others.
Exactly.
Yeah. Okay. Okay. So in the chat, we did get a question of an attendee who had asked if can you post the links for the videos that was showed. And so I just wanted to let folks know on the webinar that we will be following up after today's webinar with an email, a mahalo email to those who have attended today. So information and resources will be provided, so folks be able to keep an eye out for that, and we will reference the links of the videos there as well. So yeah, I think those are great videos to be able to use in different respects for teachers having conversations, other parents having conversations, and so forth. So thank you, Dr. Limaye. I know those the links are in the chat, I see. And definitely for us, myself included, very eager to rewatch them and trying to practice the MI or the motivational interviewing approaches as well. So,
and there's one thing that I will say very quick, Michelle. There was also a video that we did, and I didn't show it to you all here yet. But there was one that we did that essentially was directly for younger children to explain to them how the vaccines were made. And so I don't know if people are familiar and if they sort of remember the Miss Frizzle. I don't know if that rings a bell with folks at all, but it's essentially like how she was like Miss Frizzle in the Magic School Bus, and she essentially explained how science, how you can essentially different parts of science. And so we used a very similar approach. And if we have a minute, I can try to find it so I can show you all what I'm talking about. But what it does, it's very, I will say this, it's very, very, very dorky because it's me pretending like I'm going into the bloodstream. But I can show this to you. Yeah, I can find it if we have a minute, Michelle. If not, that's okay. I don't have to show it. But if we have a minute, I can show it. It's about 2 minutes long if people are interested. It was specifically for children between the ages of 5 to 11.
Yeah, Dr. Limaye, I think that would be great. And
Okay.
I think that'll give some folks some time if they have additional questions, to put that into the chat so we can continue that Q&A. But I think that's, one of the interests that our attendees have today is kind of how to have those conversations with children as well. So I think that would be a nice addition. And I love the Magic School Bus, so I think that would be great.
Okay, let me just pull it up. Give me 1 minute and I will pull it up here.
Hi,
Oops, hold on. Let me share my screen again and then we will try this. Okay. But yes, I have to warn, it's very dorky because you'll see. Okay, here we go.
Hi, I'm Rupali. I'm an associate scientist at the Johns Hopkins Bloomberg School of Public Health. Today, we're going to go on an mRNA journey. Let's go.
Let's go.
On this trip, we're going to see how mRNA vaccines work up close. Meet our vaccine recipient, Morgan. They're only 10 years old, so they will only receive half the dose that their parents received. Like their parents, the vaccine will enter into their upper arm muscle. Let's go into the bloodstream. The M in mRNA stands for messenger for a reason. It sends a message to your cells to develop something called a spike protein, which is harmless. Let's zoom in here. The cells display the spike protein on their surface. See, once that process is complete, soon thereafter, your body will remove this spike protein.
You're done. You're done.
Our immune system realizes that the protein does not belong here. Wait a minute, who are you? So, how long does it camp out for? Not a long time.
And stay out.
This triggers the immune system to produce something called antibodies. Antibodies help the immune system think that there is an infection in your body. Oh, and what COVID tests look for are antibodies. Antibodies do not show up in your immune system until a few days after you have been infected. At the end of this journey, our bodies will have learned how to fight off a future COVID-19 infection. This patient may experience slight discomfort in their arms for a few days. Any side effects that happen after the vaccine will be temporary, and all it means is that your body's system is ready to fight against a real COVID-19 infection.
So anyway, you could see why it was a little embarrassing to make, but one of the reasons we did it was to explain and so kiddos would understand what was going on in their bodies when they got a vaccine.
No, that was such a pleasure to watch, and definitely jumping in and being brave to record and put that together. And I'm sure even your family members really appreciate that too, or kind of setting that example for your children as well. And so I guess that brings up another question that I have too regarding, I guess, best ways to outreach to children about just vaccinations in general. And that can be from an education perspective or even just within our family conversations. Like, what would be the best, some best practices in how we, encourage children or youth to learn more about vaccinations?
Yeah, I mean, I think one way to really raise it is to talk about and let children know and any young people know that they're part of the solution, right? That this is a community effort, that for us to get out of the pandemic and to return to normal, or as normal as we would like to try to get to, is that everyone can play a role. And that's the way that we usually talk about this. And that includes children, that includes adolescents, that includes everyone. And I think the other thing to really think about is to also discuss with them, it's a way for them to prime their immune system and protect themselves, but it's also a way for them to protect family members. A lot of individuals in homes that are multi-generational, if you live with your grandmother or a grandfather that might be more susceptible to severe COVID, that's how really you can play a role and protect your family as well. And that's the way we've really talked to children about it.
Cool. So we have one last question. What is your perspective on people saying we are now, it's endemic, and how will that relate to vaccinations?
So I think that COVID is here to stay. Part of that has to do with the fact that we have a huge proportion of the population globally, also here in the United States, but globally, that is not vaccinated. So the whole reason a virus exists is to replicate, right? All it wants to do is find a susceptible host. A susceptible host typically is someone that's unvaccinated. So we will continue to see this virus. I think the biggest thing that we can think about now is how do we reduce severity of the virus? The reasons that vaccines were made were not to prevent the virus, but the main reason is to prevent severe infection. That's really the whole point of any vaccine. We want to prevent hospitalization and we want to prevent death. What's been great about the vaccine products that we have that are available here in the United States is that they're very safe and they're very effective, much more effective than many of the other vaccines that we currently have for childhood vaccination schedule. And so I think the best thing we can do is how do we continue to reduce that risk for severe COVID? Again, thinking about if you are going to be in contact with individuals that are at higher risk for severe COVID, so people that are older, people that are immunocompromised, people that have underlying health conditions or other respiratory conditions that put them at higher risk. So it's really important to think about not only your personal safety, but those around you. And so one instance I can say is, for example, I will continue to wear a mask indoors, and it's not for me, it's for other people that are at higher risk than I am. I think it's a small price to pay for us to really do our part in keeping our communities safe.
Wonderful. Thank you, Dr. Limaye. That was our last question. I just wanted to ask if you wanted to leave our attendees with any final thoughts before we wrap up today's webinar.
I don't think so. I think that if there are any questions, feel free to reach out. I tried to put in the chat the link to our course. So if you are interested in learning more about how to communicate with individuals, the course is free. You just have to sign up and it's free. And we'd love your feedback. We've gotten some really great feedback so far. And so again, our goal here is really to make sure parents are really making an evidence-based decision. And I think teachers play a really crucial role in making sure that this is happening. So thank you again for all teachers and school administrators and other school staff that are really trying to promote healthy behavior.
Oh, I want to thank Dr. Limaye again for being our guest for today. The communication strategies will definitely be helpful as we continue our work with our communities during this pandemic and beyond. Thank you to all of you on the Zoom who's joining us today for this webinar. And lastly, I also want to thank the Hawaii Public Health Institute staff, our Hi-Fi staff behind the scenes, helping to ensure this webinar runs smoothly. Just want to share a brief reminder, our next webinar, Improving Community Health during the pandemic and beyond will take place next week, April 6th at 1 p.m. Hawaii Standard Time. Thank you again all for joining us. Be safe, be well, aloha,